If you have to visit an emergency room in the middle of this COVID-19 surge, be prepared to wait. Good evening, I'm Rolly Hoy.
And I'm Marlisa Goldsmith. Hospitals are getting hit hard by the increase in patients, and THV11's Frederick Price spoke with medical professionals to see how they're trying to control the situation.
Every day over the last several weeks, we've seen an acceleration in the number of Arkansans seeking care in our emergency departments.
The emergency room is naturally one of the busiest spots in any hospital.
Not everybody who comes to the emergency department needs, emergency treatment. But when they do, we have to take the sickest person.
But in the last month, nurses like Helen Palencia say they are overwhelmed because of the increase in people coming to the ER.
Even just 2 months ago, our waiting room at most maybe had 10 people. And now, we've got like 30 plus people waiting in our waiting room.
Dr. Raul Supal with UAMS says usually patients can expect about a 20-minute wait time. But with the recent surge, he says that could be much longer.
Across all times and all days, 2 hours or so to get back to a room. But there's a range to that, as I mentioned. So it can be fairly quickly extending out to 4+ hours, unfortunately.
At CHI St. Vincent, it's a similar story for the ER staff.
Not only an increase in the number of COVID patients that we're treating, but also an increased number of people that are ill and more acutely ill than we'd ordinarily see during the month of July.
Chief Medical Officer Jerry Jones says they are equipped with more rooms beyond the ER to handle minor visits.
Our staff in the emergency room is trying to be both flexible and creative in ways that we are able to get to patients that are not going to need to be admitted.
Still, they are working to find ways to cut down on the wait time so people who are not severely ill can go home quickly.
So we have physicians that will go out and will actually begin to see and visit with patients when they first present to our triage desk.
In Little Rock, Frederick Price, THV 11 News.
The struggle to find rooms in our state's hospitals comes as COVID-19 continues to grow out of control here in Arkansas.